The federal government is pledged to implement recommendations from the midterm review of the National Strategic Plan 2021 to 2025 on tuberculosis, leprosy and Buruli ulcer control. The Minister of State for Health, Ekumakama Joseph Nkama, made the pledge while highlighting the positives of the plan and the progress made thus far. Benedict Uku has more on the report.
The midterm review on the National Strategic Plan is aimed at assessing the progress made in the eradication of tuberculosis, leprosy and Buruli ulcer. Reviewers from outside the country in a 2-week process addressed various aspects of the plan and made recommendations to improve the plan and its objectives. After reviewing the recommendations, the Minister of State for Health, Ekumakama Joseph Nkama, pledged to see them implemented.
Today, we have heard the review findings, and I'm pleased to note that the Nigerian TB program has made significant progress in the following areas, among others. Significant increase in TB case notification, with improved TB treatment coverage, very high treatment success rates, good involvement of the private sector and community in TB control, and good collaboration between TB and HIV program. I have also noted areas where we need to improve on as we implement this NCP program. Permit me to thank all the reviewers for their hard work in the past 2 weeks, and also promise that we will ensure that their recommendations are implemented.
The National Coordinator, National Tuberculosis, Leprosy and Buruli Ulcer Control Program, Aniaike Chukuma, called for more funding to reach the target.
Nigeria is doing well in terms of case notification and our national drive towards ending tuberculosis in the country. We won't be able to do that if we do not have necessary funding. So we need additional funding to ensure that we continue with our drive towards ending tuberculosis in the country. So we are calling every million Nigerian, the private sector, the government, civil society, philanthropies, to come to the rescue of Nigeria in our strive towards ending tuberculosis in the country.
The representative of the Director of Public Health, Dr. Geoffrey Okatubo, said the goal is to achieve the target by 2025 and also to create more awareness on the diseases to help eradicate them and to prevent them.
The midterm review is important to the Federal Ministry of Health, as it will set the precedent for the National Tuberculosis Program to achieve its set targets at the end of this National Strategic Plan. Let me assure you of the Federal Ministry of Health's readiness to collaborate with all stakeholders to ensure that we put an end to the TB epidemic in Nigeria.
The midterm review made recommendations including an improvement in the quality of health care and reporting of cases. The various levels of government were also cited as needing more attention to achieve the set goals.